Hello everyone. After a successful access opening, the thing that follows is the biomechanical preparation. So what is a biomechanical preparation and what do we do in it and what do we ensure is that we remove all the radicular pulp tissue. No pulp tissue has to be left in the canals. If anything is left inside the canals, if any pulp tissue is left in the canals, then there is a high chance that the patient will have post-operative pain or infection also. Because we know in the decayed tooth, pulp is the pathway for the periradicular infection. And if that infection has already passed to the periapical tissues, then the only way for it to happen through the endodontic origin is the pulp, right? So if that pulp is still left inside the canals, how do we ensure the disinfection? So the biomechanical preparation is also important to facilitate the disinfection of the tooth and the periradicular tissues. But on the name of disinfection, we should not be encroaching on all the tooth structure that is present. We need to save as much of the radicular dentin for the tooth to survive longer. Because the endodontic success does not only depend on the caries removal or disinfection, but also on the conservation of healthy tooth structure. The more you conserve, the better the prognosis, the longer the tooth life. But the thing here is, the word biomechanical preparation is a bit of outdated because biomechanical preparation contradicts the conservation of tooth structures. Because biomechanical preparation actually involves usage of large files to make sure that there is no pulp or its ramifications present inside the radicular space. But with the emerging concepts of the preparation, the word biomechanical preparation, I think, would soon be replaced to chemomechanical preparation. So, what's the basic difference between these both biomechanical preparation and the chemomechanical preparation is that in the biomechanical preparation, which was coming for a very long time now, the biomechanical preparation involves a lot of files, the endodontic instruments that are used inside the canal, which are of larger diameters so that there is no pulp left inside the canal which is removed manually. But coming to the chemomechanical preparation, we use the lesser diameter files. We try to conserve as much as dentin possible and we use a lot of chemical agents which will dissolve the pulp, disinfect the pulp space, and then we use a better obturating material which have a better penetration. Not the obturation material actually, but the sealer material which has a better penetration into the ramifications or which has a better seal to the dentin and all of those where we reduce the amount or we reduce the diameter of the file sizes, but we use a lot of chemical agents to remove the pulp tissue and disinfect the canals. So if you look at the basic difference between both of these concepts, biomechanical preparation uses large files with less irrigation, while the chemomechanical preparation uses small files with more irrigation. And the difference is not actually in the amount of irrigation but the irrigant activation. It's in the activation of irrigation. We will speak about different irrigants activation, the importance of irrigant activation, which irrigant to be used in which cases. All of those will be discussed in the later videos. But today I just wanted to briefly tell you about the difference between the both concepts of biomechanical and the chemomechanical preparations. Now again, coming back to the BMP, what are the important things that you have to know about BMP is that the methods, techniques, files and file systems. There's not much about methods to be discussed because methods are only two, which is your hand and the rotary techniques. where you prepare the canals through your hand instruments, or you prepare the canals with the rotary instruments using the endomotor. And then coming to the techniques of BMP, there are a lot of techniques that have been described in the history, but there are three major and very important techniques that everyone who wants to start an endo has to know about. And those three techniques are: one is your step back technique, and the next one is your crown down technique, and the final one is your balanced force technique. These three techniques form the very basics of the BMP. We will continue learning about all these techniques in the further videos. And coming to the files are again hand files and the rotary files. And file systems again is a complete different topic which will be discussed in the later videos. Do like, share, and subscribe, and thank you for your support.